For these basic lessons, your patient's incision should run from left to right in front of you. Think spay incision and how a patient is placed on the surgery table. Remember, you will not be able to move your patient during the lesson since you cannot rotate your patient on the surgery table. Your tissue forceps will be held in your left hand using a pencil grip. Your needle holders will be held in your right hand with your thumb and ring fingers in the finger rings. Your pointer finger will extend forward, and that will be used to stabilize the needle holders as you push the needle through the tissue. The tips of your needle holders will be used to grasp the needle 2/3 along the body of the needle and will leave the needle perpendicular to the needle holders once it's grasped. Let's review some terminology. A bite is the act of pushing the needle through tissue. That is a bite. A throw is when you align your needle holders between the tail of the suture and the needle of the suture, wrap the suture around once, grasp the tail, and pull it through the loop. That is your first throw. A knot consists of 2 throws. You will realign your needle holders, wrap the suture around the needle holders once, grasp the tail, and pull it back through. That is a knot. You will hear us refer to a special knot called a surgeon's knot. It's performed basically the same way, with one minor difference. You will still take a bite of tissue. Okay, let's align that so you can see better. Align your needle holders between the tail of the suture and the needle. Wrap around once, and for a surgeon's throw, you wrap around twice. Grasp the tail and pull it through. Remember, this is a knot. That's your first throw. Realign your needle holders. Wrap the suture around the needle holders once and pull the tail through. That is a surgeon's knot. To make a secure knot, you're going to have to place at least 2 knots, one surgeon's knot and one regular knot. Okay, let's move on to your cruciate. A cruciate consists of 2 bites. So you're going to enter on the opposite side of the incision, and you're going to exit on the close side of the incision. I'm going to just push everything down so that you can see a little better. So as you can see, I've entered opposite the incision and exited near. You're going to move over just a little bit, about 4 to 6 millimeters, and you're going to take your next bite. You're going to enter on the opposite side and exit on the close side, just as you did before. Okay, make sure when you pull your needle through, you are on the outside of the loop. When you pull the tissue or pull the suture through the tissue, you're going to notice a diagonal line. That means you're on your right track. Now for your knot, align the needle holders, do your surgeon's throw, so twice, grasp the tail, pull it through. And as you can see, we have a nice little X here. Remember, that was your first throw though. You need to continue your knot. So wrap around once, grasp your tail, wrap around once, grasp your tail, and pull it through. And now you have an X, or a cruciate knot. Okay, let's do that again. We're going to take a bite. I'm going to line that up for you so you can see better. Take your second bite. Make sure you don't go through your loop. You can see your diagonal, so you're on the right track. Make your knot, so align your needle holders, surgeon's throw, pull it through. You have your X. Complete your knot with your next throw. Wrap around once, and pull it through. Now remember, I said a secure knot requires, a secure knot requires 2 knots. So here's your second one. First throw is regular, wrap around once. Second throw, wrap around once. Okay, now your cruciate knot is much more secure. Okay, let's do that one more time. Bite. Bite. Don't go through your loop. See your diagonal, so you're good. Surgeon's throw. Regular throw. Realign for your next knot. Regular throw. Line it up. Regular throw. Okay, if you look at your knots, you will have 3 X's, since X means cruciate or cross. You will have your entrance and exit points will be evenly spaced on either side of your incision. Your bites will be evenly spaced, and the actual suture knots will be evenly spaced along your incision. You will also want to make sure that your knots are not too tight, so that you can actually fit a hemostat underneath your knot that will allow for swelling. All right, and there's your cruciates.